Thank you. The theme is dynamic control of motor disorders in the early stages of Parkinson's disease. Parkinson's disease is a chronic progressive neurodegenerative disease associated primarily with degeneration of neurostellar neurons and dysfunction of the basal ganglia. Here we can see the biochemical marker of Parkinson's disease is dopamine deficiency in the striatum. Clinical symptoms are manifested in death of 50–80% of neurostellar neurons. There are etiology and pathogenesis. There are motor symptoms and non-motor symptoms. The majority of symptoms are non-motor, such as postural disorders, mental disorders, vegetative and sensory disorders. The main motor symptoms are hypokinesia, rigidity, and tremor. Here we can see the most common motor symptoms: neuropsychiatric disorders, sleep disorders, vegetative disorders, and sensory disorders with metabolic disorder. Motor disorders are characterized one-sided of disease manifestation, the presence of racing tremor, and common asymmetry with more pronounced symptoms on the side from which disease began, and the progressive course of the disease. The main directions of treatment are pharmacotherapy, medical and social rehabilitation, physical therapy, and neurosurgical treatment. Here there is a list of more common medicaments for treatment. It's like L-dopa medicaments, stimulation of dopamine release from receptic vesicles, MAO-B COMT inhibitors, dopamine reuptake inhibitor, recyclic antidepressants, dopamine receptor agonists, and cholinergics. For diagnostics and evaluation of effectiveness of treatments with disease, usually I used clinical examination and special scales like UPDRS for assess severity of disease. It can assess thinking, behavior, mood, daily activity, study of the motor sphere, occupational treatment, scope out for assessment for vegetative symptoms, monitoring cognitive assessment for cognitive functions, and Parkinson's disease quality of life questionnaire, and so on for scales for anxiety, depression, severity scale, fatigue severity scale, and so on. The search for objective methods of early diagnosis of Parkinson's disease is actual. Taking into account the substitutive symptomatic therapy of this pathology, it's also actual to assess the effectiveness of the treatment. And in our study, a non-quantum system of objective assessment of movements is used for evaluation of the motor symptoms. Here in the slides, we can see how we assessed postural changes at rest. We can see postural changes at frontal plane and sagittal plane. We can assess postural changes of treatment, pelvic rotations, and shoulder rotations. And the next slide, we can assess evaluation of working parameters like length of steps, number of steps, angle of steps, trajectory, and so on. So we can assess tremor and rigidity movements. And for assessment of movements, we can see graphic pictures of movement in three different planes: horizontal planes, vertical planes, and sagittal planes. So we can see trajectory, speed, and angle, and so on. Yes, and its conclusions. Our study is continuing, and we will publish the results later after. And objective analysis of motor symptoms could allow for a more reliable diagnosis in the early stages of Parkinson's disease, and can help to choose effective pharmacotherapy and other methods of treatment. And comprehensive monitoring of the effectiveness of treatment of motor and motor symptoms in early stages of Parkinson's disease can improve the quality of life. Patients expand the possibilities of social protection. Thanks for your attention.